We begin with new guidance from the state health department for kids heading back to school as the Delta variant is spreading very rapidly. Good afternoon. Thanks for joining us for 7 Action News at 5. I'm Alan Campbell.
And I'm Glenda Lewis. These recommendations are in many districts, and they're going to be looking over and finalizing their safety plans. So we're going to break this all down for you. The recommendations call for indoor masking for all students and staff, regardless of vaccination status. They also call for physical distancing, 3 feet between students. The health department urging all eligible students and staff to get vaccinated. It also calls on schools to make sure proper disinfecting and hand washing protocols are followed and to make sure there is proper ventilation. Students who are sick should stay home and should be tested. These guidelines following recommendations from the CDC.
And they come at a time when cases in children are on the rise all across the country. Right now, Michigan, listen to this, has the 5th highest number of cumulative COVID-19 cases in kids in the nation. That's just behind California, Illinois, Florida, and Pennsylvania.
So let's bring in our chief health editor, Dr. Partha Nandi now. And Dr. Nandi, the Delta variant on the rise, many children still not eligible for the vaccine. So what are your thoughts on these new school guidelines and how to keep our kids safe?
No, I agree with them. I'm a parent of 4 kids, and 3 of my kids are young boys who aren't yet vaccinated because they're too young. And the starting age for kids to get COVID vaccine is 12, right? So my wife and I are cautious and don't take unnecessary risk. At the same time, it's important for kids to see their friends. So here's my advice, right? The most important thing anyone can do right now is get vaccinated. I keep saying this, if you're eligible, this will really help cut down the risk for young kids if they're surrounded by vaccinated friends and families. Next, talk to your children about hygiene etiquette. Explain why it's important to wash hands often and to sneeze and cough into the elbow or a tissue if it's available. When parents are scheduling play dates, have them outside if you can. So what we do, it's not only safer, but also increases kids' activity levels, reduces their stress and fatigue, and promotes creativity and imagination. However, if play dates have to be indoors, avoid the small rooms, right? Good ventilation will help. And finally, I highly recommend masks, just like the recommendations they're making from the state for any indoor activity. Data has been shown that masking is effective and can reduce the risk of getting infected by roughly 50%.
Well, Dr. Nandi, Florida is now leading the country with the highest per capita rate of children hospitalized with COVID-19. Is the risk for serious illness higher now for children?
Yeah, it's a little upsetting about Florida, isn't it? I mean,
Yeah.
You don't want to be number one in this category. They're averaging about 35 pediatric hospitalizations a day. And in Louisiana, pediatric cases in the ICU are reporting patients that are only a few months old. I mean, this is crazy, right? So the Delta variant is capable of causing serious illness in those who are young and healthy. It's just not like people that are older. Young and healthy folks can also get affected. I'm also very concerned because cases in children are on the rise. We talked about this just at the top of the hour. Almost 72,000 kids were infected just last week. I'd like to stress to parents, if your child is 12 and older, please, I'm begging you guys to get them vaccinated. So far, almost 9 million teens aged 12 to 17 have been vaccinated with Pfizer's vaccine, and side effects are rare. We talk about myocarditis, right, which is inflammation of the heart muscle, and a lot of parents ask me about that. Represented just 4% of the reported side effect cases, a small number, a very small number, and it's still scary to patients, right? But listen to this. A study found that girls had 21 times the risk of myocarditis, and boys had roughly 6 times higher risk after getting sick with COVID, right? With getting the